You're about to enjoy a Cloudcast original. Local stories, local storytellers, local brands.
Have you ever felt that you as a woman may not appear to measure up when you see incredible women in strong roles? You may be surprised when hearing from women in these positions and how we all share many of the same challenges. Thank you for joining us for the CEO Leading In podcast with Rebecca Jones as we share the journeys of women.
Hello, I'm Rebecca Jones, your host of CEO. We are on an exploration together to discover more about the personal journeys of incredible women in both career and life. We all have paths to share that sometimes take incredible turns, deep resilience, and courage to navigate. My hopes are that the challenges shared here encourage women to take leaps of faith and growth when a journey feels too difficult or unachievable. There is great strength deep within each one of us. These stories are meant to share the ways strong women have taken their dreams to strive and thrive to new heights despite their sometimes rocky paths and found a way to lead in. So hello, we are here today with Diane Hansen, the president and CEO of Palomar Health, which everyone knows about Palomar Health. They're doing great things over there. And so, Diane, I would love to hear a little bit about what is happening. I understand you've been with Palomar Health. You left, you came back. Share a little bit about that journey and how that happened.
Well, thank you, Rebecca. My pleasure to be here today. So I appreciate you having me on. I worked for Palomar Health from 2002 to 2006. Moved to Indiana, worked for WellPoint and Indiana University Health. I was there for about a total of 6 years, came back to Palomar and sunny San Diego in 2012, and have had an opportunity to step into the CFO role in 2014 and then step into the CEO role in 2017. So I'm very excited to be here and love this organization and love my job. It's just a great place to be.
Well, it's always, I talk about this often, it's always a little bit easier to get up and go to work when you love your job, isn't it?
Absolutely. Absolutely. And I've had jobs in the past that I haven't absolutely loved. And when you have to drag yourself out of bed to go to work every day, that's really a tough place to be. So I'm very fortunate, I should say, to work with some really incredible people and really love my job.
Wonderful. Well, so who is Diane the person? Let's talk a little bit about that. Do you have a fun little story about your childhood that you might want to share with us that people don't know?
Yeah. I have a lot of stories, I'm sure, that I could tell, but, my dad was a race car driver, and he actually raced snowmobiles, and he was very competitive and raced stock cars. And so I spent a considerable amount of time at racetracks, at race events when I was growing up. And I blame my dad for three things in my life: my competitiveness, the fact that I love fast cars, and most importantly, the fact that I drive too fast. He's no longer with us, but he's still a heavy presence in my life.
You know, what's interesting, I thought you were going to say that you spent a lot of time in the emergency room, which led you to healthcare.
Fortunately, I work in healthcare, but
well, I mean, think about it. You're trying to keep people healthy and fit and all of that. And your dad, as you were growing up, you were exposed to him being very competitive, but also did he ever crash?
Nothing serious. We didn't have any situations, and especially when you're racing snowmobiles. That can, as you can imagine, be pretty gnarly when there's a wreck. But I never saw him in a serious crash. So that's the good news.
Well, that's wonderful. That is a fun story. I have to say, that's the most exciting story I've heard yet, and I don't have any exciting stories like that. So Diane, as a leader and a woman, and in a very high-powered sort of job too, There's got to be one word that people often say about you or that you say about yourself. What is that one word that you think describes you the best?
Thinking about this, there's, I have a mantra, and I'll share that with you later. But I would say if I could use three words, I would use that mantra. But ultimately, I think it's aspirational. I aspire every day to do more, to be more, and to have a greater impact in the community that I live in, and for the patients that we take care of every day.
Wonderful. So, did you start out in healthcare, or what was your first job? Where did you begin, and how did you get into healthcare?
Yeah, so my path is a little bit different than most individuals. I actually am a CPA, started out in public accounting, doing all the fun tax auditing, corporate closings, all of that kind of stuff, but very quickly learned that wasn't where my passion was, that wasn't what excited me, and sitting behind a desk and doing spreadsheets. And believe me, I still have a passion for spreadsheets, but it wasn't really what drove me and what, connected with me in terms of kind of that purpose of the work that you do. So had an opportunity to go to work for a CPA firm that did strictly healthcare consulting, and that grew into kind of the healthcare background. I learned a lot from that organization, and then had an opportunity to go work for a hospital system in Tampa. So kind of a different path, but and I totally appreciate the fact that I have a finance background, because that has benefited me in a lot of ways, but definitely a little happier in the healthcare side of the world.
Well, I think as you're always having to think about cost containment and all of that, how do you provide the most service possible for the best value? I think that's actually a very good path for you, and a lot of experience that maybe most CEOs don't have in that business in healthcare. So I appreciate that, because as someone that would need to come to your to the hospital, I definitely want the best value, and I definitely want the best service. And so having, those two things as priorities, but, also that you're paying attention to that. No one wants to hear about waste. So I think that's a really good background for you.
Well, thank you. It has absolutely benefited me. And I think you're seeing that the traditional days of people not understanding the business side of healthcare are waning. More than ever, it's incredibly important for us to do exactly what you're talking about, right? Have both of those things married up. How do we provide the highest quality care, the best patient experience, but do it in a way that is cost effective, efficient, and really provides great value to the patients and to the community.
So that kind of leads us to the next thing. How do you measure success?
Oh gosh, there's so many things I could say, Rebecca. So many things. I think I measure success by how happy the people are that work for me. I have an incredible team. And if I'm creating an environment, a culture where people come to work and they're excited about what they're doing, then that's really, to me, I've been successful. I've been successful at creating a place where individuals want to come and work, where physicians want to come and practice. And so that's, ultimately that's what it comes down to for me. That doesn't mean we don't make hard decisions, but it does mean we're really trying to create an environment where people can learn and grow and just, be the best that they can be as well.
So, this is kind of an interesting little segue, but have you seen a difference in keeping people happy to come to work during the pandemic more than ever? Because I think a lot of our listeners would, that's kind of a burning question, because there's been a lot of discussion about how much we've reliant. And I have to say, our healthcare workers, oh my gosh, they have been through so much. And I know that our communities are so much behind them, and thank them for us, because we are so grateful for everything that they've done every day. They've worked so hard, tirelessly. without a lot of sleep and, in very difficult situations. So that you are leading these folks, have you seen that it's more difficult right now during COVID?
It has been. It has been. And largely because, our teams are tired. They're tired. And even though we've seen the numbers come down, we're starting now to ramp up with other, ED volume, trauma volume. We are a trauma center, so that keeps us pretty busy. But, encouraging our teams to take time off, to do those things that energize them, that keep them connected to the work they're doing. It was very difficult during the pandemic, and we did our best, as a leadership team to round and make sure that we were supporting them any way we could. Did our best to bring in additional support staff, whether it was respiratory therapists or additional nurses, to find better ways, to deliver care. We even doubled up, patients in our ICU rooms when things, became really intense. And I think when you started out, you were talking about how great those individuals are and that they really are the heroes, right? And I do believe that that they did the incredible work of angels throughout this entire time. When I would round on the ICUs and talk to the nurses, their compassion, their patience, their professionalism, their skill, it was just all on display. And they were just really, really amazing. It was unbelievable to be a part of the work that was going on. And even though, I don't deliver care at the bedside, probably wouldn't be very good at it anyway. My job is to make sure that I'm clearing hurdles and creating a work environment that the people can, that are delivering care can do that to the best of their ability. And just so proud, so proud of the work that has been done. Our team had a video put together, and it was a look back at the last year and all the work that had gone on. And it brings tears to my eyes every time. I'll have to share it with you at some point. I even shared it at the board meeting this past Monday and got a little emotional because, there are clips in there of what we call a code Rocky, where we've had a patient, a COVID patient who had been there for weeks upon weeks, and it was questionable whether they would pull out of the illness. And then you see our staff lining the halls and lining the pathway for them to leave the building when they got discharged finally. And it is just such a touching moment, and it just brings back all of the emotion and all of the work, and again just reignites the proud feeling I get to be a part of this organization and the work that goes on here.
So, Diane, I have two takeaways from all of that. One is, first of all, I love that you actually were going down and spending a little bit of time with the staff, because I think that is part of what continues to keep people inspired, that if you are willing to go down and let them know how valuable that you are to them, I think that goes a long way, and it helps people remember, yeah, you know what, I'm valued, and I am contributing, I'm doing important work, and without me, this all can't happen. I really appreciate that you did that. I think that's extremely important. But the video, as soon as you said the video, I was thinking I would cry definitely over something like that, because there were so many ups and so many downs and so many people fighting for their lives. And the fact that going back and looking what you get through, that's very difficult to get to where you are now today. And yes, things are much better, but we're still in the pandemic. We still need to be safe and healthy, and working toward that goal of getting back to all of the normal things that we love to do as human beings. But spending that time and taking the time to do something so intentional to bring up the spirits of your staff, I definitely want to commend you in that, because I think that's so important. now more than ever during a pandemic. And I don't think this will be our last pandemic. So being intentional and really creating a past of what a pandemic can look like, and then also taking that to the next level, and the next time, unfortunately, we'll probably be in a situation like this, I think is something that's probably unique to you.
Yes. And, hopefully I would like to say that we will never have another pandemic, but you and I both know that that's probably not the case even in our lifetime. So I value our employees, and they are our number one resource, honestly. I mean, they're the reason that we are all here at this organization, and because they are delivering great care. And, I really believe, Rebecca, that the individuals that dedicate their lives to taking care of people, to taking care of others, there's no more noble work than that, right? They commit, the physicians, the staff, the RNs, the techs, everyone that comes to work every day and takes care of people. I mean, I just think it's commendable, the work that they do. I'm just happy that I can support that in some way.
That's wonderful. So after all of this, how do you find a time to balance everything, your work and your personal life? How do you do that?
Well, it's a great question. I'm not sure I do it really well. So I'll qualify it by starting there. I think one of the things I've learned over my career is that you can't do it all the time. You can't. And you have to learn to rely on those around you, hire really smart, great people that you can rely on, to step in where they're needed. But I also do believe it is about prioritizing those things that are important to you. When my daughter plays soccer for the University of Montana, and when she's in season, I tell the employees, look, that's really important to me. It's important to me that I have an opportunity to go and watch her play. It won't last forever. And that's one of the things that keeps me grounded, that, really re-energizes me, is being inspired by her and how hard she works. So you will find that when she's in season, every other weekend I travel. I'll leave on a Friday morning or a Thursday night. I'll travel to wherever she is. She might be in Utah or Washington or Idaho or Northern California or Montana. Even I've gone to Iowa to watch her play. But that's important to me. And so you have to prioritize the things that are important to you above everything else, even when you have, a difficult or a demanding job, because it is important also for you to take care of yourself. So if I've learned anything, it really is about, the relying on the people around you, and also prioritizing those things that you can't give up, right? That are just really good for you as a person, mentally, physically, and make sure that those are the things that you make time for.
Well, because they refresh you. And if you're not refreshing yourself, how could you possibly lead others and set a good example? Because we all need to take care of ourselves. And I'll admit, I have a very tough time finding time to get to the gym, all of that. I was talking to a guest another time, and I was telling her, I said, if the gym's in my garage, I have a harder time than if I actually make the time to drive to the gym and get there, because then I feel pressured because someone else is watching me, and I know that they don't want me to waste my membership, and they want me to do what I need to do. And so I think not prioritizing those things will really hurt us in our leading and being able to have credibility, I think, with the folks around us too.
Absolutely. And I did the same thing. I actually had to hire a trainer to make sure that I was making that a priority. It's much more difficult to cancel an appointment with your trainer, or to not show up or to not work hard when you've got somebody paying attention, right?
Absolutely. So I have a question about being a female leader. What is the most significant barrier that you think that you have experienced?
Great question. And I would say not so much a barrier as much as a frustration. I have a difficult time with people who are unwilling to give people a chance, right? For example, when I stepped into this role, I had a lot of people that didn't think I was the right person to fill this position, to lead this organization. And it wasn't based on my experience. It wasn't based on whether or not I had the skill set to do the job. It was more based on me being a woman, quite honestly. And so I'm the first woman to lead this organization. I think at one point there was someone who stepped in on an interim basis many years ago that was a woman, but I'm the first woman to lead Palomar Health. And I will tell you, I have a tremendous amount of respect for many people who have been around healthcare, been in this organization for a long time, been in the community for a long time. The individuals that gave me a chance to prove myself and judged me based on my performance and the work that I've done and the success of the organization, that doesn't bother me because they're open-minded enough to give me the opportunity to prove them wrong, right? But the individuals that have been very vocal about me not being the right person, they haven't looked at the performance of the organization. All I was asking for was a fair shot, right? Give me a chance, then judge me based on my performance. And it's frustrating out there. I know there are a lot of people in the same place that have run up against that kind of frustration and have had to deal with that. I think the best thing that I did was continue to have a strong resolve and to persevere and to keep plowing ahead, believing that what I was doing was the right thing and trying to do things in the best interest of the organization.
That's interesting that you bring that up because I too am the first woman that is serving as mayor in San Marcos.
Wow!
And I have felt the same things. There were many people, and I still continue. I think there are still some that continue to push back merely because I'm a woman, not because of the job that I'm doing. I mean, gosh, during a pandemic, I think it really has put our leadership at, I think, a spotlight and all of the things that we can do and that we're willing to do. I spend a lot of time promoting all of the wonderful things that are still continuing to happen in my organization, I think much like you as well. And there are some people that will always be unwilling to pay attention to that because you're a woman and because that they don't want to see the change and the shift, and seeing women in power sometimes intimidates people. And so I agree with you. And I definitely feel for you because I do know what that feels like. I don't really have people that work directly underneath me. And so I really can't share my experience on whether I have resistance on leading people. But I do have resistance in just, moving forward. And this is where we're going as a city, all of that. So I wonder, do you have any experiences as leading men and what that looks like, what that resistance looks like?
I haven't had much of that in this role or in my career, honestly. I think that, that individuals, if they're male and they're on my team, and I'm a big believer in teams, right? I think we are all stronger together. I think to have diverse opinions sitting around the table makes, the idea, the thought process, I think it makes it all, it better. It's just a better outcome all the way around. I also think that the males that I've worked with or that I've led and have been on my team understand that it really is about that, right? I don't care what your ethnicity, your background, your religious preferences are. It doesn't matter to me. I'm really about finding the best people for the job. So whether you're male or female or the color of your skin, it really doesn't matter to me. I'm looking for the best people who are committed to moving the organization forward, making decisions in the best interest of the organization, and ultimately folks that can work together. Right? I work very hard. I expect my team to work very hard, but I also think we can have a tremendous amount of fun doing that. So that's really the goal. I've been fortunate. I think if there were males on my team that had a difficult time, I think they know ultimately they wouldn't be successful in this environment. So I hopefully won't have that in the future, but I'm sure that there are situations out there where that has happened.
Well, I think one thing that you touched on, I think, is really important, and that is discussion and differing points of view. And I think, I always tell people, I know it sounds weird, but one of my favorite parts about campaigning is actually knocking on a door, having no idea who's going to be behind that door, and finding out what's important to them, because it helps me do a better job. That's what government's like. In your job, you have surveys, you have all sorts of interesting ways to get that feedback from people. But I think feedback actually helps us. And as a team of people working together for a common goal, and that is, again, delivering the best healthcare possible for the best value, how do you do that when you've got all these different voices? And that is everyone having an end goal. And the end goal is that we all do well, right? We all thrive. Right. We all prosper. We all want to do our job well. And, government's no different than that. Although I think sometimes, and you talked a little bit about this too, that this kind of a person wouldn't do well on your team. And that is when people are unwilling to listen, when they're so stuck in whatever they want that they can't hear anyone else's voice. And I would say that in this environment, it's been really tough. I think as people have been in a pandemic, stuck at home, I think their emotional situations have really been highlighted by this, because they become more stuck with their way of doing things and less willing to listen, which I think is very, very dangerous in this environment. So have you had any situations where you have a team member that before the pandemic, they were a great part of the team, and then you kind of go, oh gosh, what's going on now? I have to have a talk with them. Have you had any situations like that? Because I bet you probably have.
Yeah, no, and it's a great observation. And I love what you just said, though, about listening. That is a lesson I've learned in my career, that listening is more important sometimes than what I say, right? It is incredibly important to understand sometimes the meaning behind what's being said. And if you listen well enough, you can figure out why an individual is behaving the way they're behaving, or why they believe what they believe, or that there's a different intent behind what they're saying, because not everyone is a great communicator and they don't really always say what they mean, right? So listening is absolutely important. And I do think it is one of the things that has allowed me to be successful, not only in life, but in my career. And I do spend a lot of time talking to people on my team directly, but even individuals that report up to them, to understand what's going on in the organization. What am I missing? What am I not getting that might not filter up to me, right? Or escalate up to me, but that I need to know. So I do think that is incredibly important. And we have seen a number of dynamics for individuals on a personal level. And sometimes it is a matter of pulling them aside and saying, hey, are you okay? I'm just checking in with you. And I do that, pretty regularly if I feel like someone is not themselves. And so sometimes it's just that extra level of interest that helps them understand that, no, you know what, I do really care about them. I care about their well-being. And yes, how they function on the team is important, but it is also ultimately about what's going on in their lives, and how can I help them if there's anything that I can do. I think that when you talk about mental health, this pandemic has had a variety of impacts on people, but I think the most important thing for us to recognize are the mental health needs of our society, and the isolation, the disconnectedness, and for our kids as well. I mean, I think I'm concerned about the impacts that this will have on the future of our young kids that really don't remember a world without, a mask, or without not being able to hug people and not being able to play with their friends. So, we're going to get back to some sense of normalcy, but what are the longer impacts that might have on us as a society?
Well, I certainly couldn't agree more. I think this is a really important part of the pandemic that not everyone thinks about. I've also I feel like my job has become less mayor, more counselor, and I'm certainly not. I'm not a counselor by trade. I never took any schooling, but I think also letting people know that they matter. They matter as part of the community, that they are, for me, this is what I focus on anyway. And for you, saying, you're an important part of this team. How can we serve you? And, it sounds like that's exactly what you're saying. What is it that we need to help you with? That sort of thing. I think that is an excellent topic. We could actually talk for hours about that, I'm thinking, because I feel like not everyone really has thought that one through. And, again, back to the masking and everyone being kind of not having their individualism as much as they did prior to the pandemic. I think that's, really something that's gotten lost, I think, in all of this. But, we're getting kind of close to the end. So I've got to wrap this up. But what I want to find out is the next generation of female leaders. What advice would you give them in their journey? What one piece of advice do you think is the most important for them to remember?
I'll give you two if I can, if we have time.
Yeah,
so,
sure.
My mantra and kind of the words I've lived by since I stepped into this role and shared with my team is, the need to be bold, be brave, and be swift. And that also applies to our young female leaders and employees, coming through the ranks, because, you need to be bold and you need to be willing to take risk, right? And that the risk that you will take will pay off 10 times more than you think it will. So don't be afraid to take risk. And, be brave, because you need to believe in yourself. The best advice that I could give them is, bet on yourself. You will find you are more capable of doing great things than you even believe. So don't be afraid to do that. And don't be afraid to act swiftly, because, sometimes it's important to be willing to make some decisions and move forward. Don't try to overanalyze or, try to mix too much emotion in your decision. As women, we tend to overthink things. So I would say, act and be willing to do that. So be bold, be brave, be swift. And the last thing I will say is, don't change who you are. Be true to you. I always thought that I had to be somebody else to sit in this seat, to play this role, to be a CEO. And when you realize that you, as you are, if you stick to your goals, you stick to your targets, lead your life with integrity, lead with your brain, your skill set, you will do very well. You will do very well. So don't change who you are. Be yourself. And people will see the value in you and what you bring to the table.
That is excellent advice. And I was hoping that you would bring up the brave, bold, and swift, because I love that. And as I read it at the meeting recently with you, I thought to myself, I bet you that is her thing. And I was sure I was right.
You were spot on.
Yes, I love it. I love it. Thank you so much, Diane, for joining us today. We really appreciate it. I am so excited to see where Palomar Health goes from here. Under your leadership, I think you have a lot of room to grow and bring a lot of wonderful things to the community and keep us all healthy. So thank you for everything that you do every day.
Thank you, Rebecca. Truly my pleasure to be here. And I know you're doing incredible things in San Marcos, and I'm excited for us to partner on some of those things if we can in the future. So thank you.
Thank you.
Now that was powerful. We hope you've been lifted and encouraged by today's inspiring voice. Always remember that life doesn't look exactly the same for each one of us. Never stop dreaming, striving, and thriving. In future episodes, we look forward to bringing you powerful stories from amazing women who learn how to lead in to challenges. Thank you for listening and being part of our community with CEO host Rebecca Jones.
You have been listening to a Cloudcast original. Local stories, local storytellers, local brands. Find more stories at cloudcast.us.